Mr. Jenkins, father of 18-month-old Holly. Background information: Holly has primary ciliary dyskinesia, and although her general health is good, she suffers from recurrent chest infections which require prolonged stays in hospital for IV antibiotic therapy. IV access is always difficult, and it is becoming more distressing for both Holly and her parents each time she is admitted to hospital. At the last clinic appointment, the possibility of port insertion was raised with her parents, and they have returned today to explore this option further. So the task is discuss with Mr. Jenkins the advantages and disadvantages of portacath insertion for his daughter and try to answer any questions he may have. So actually the father of a baby who is 18 months, the father's name is Jenkins. So you have to speak with the father, right? Are you ready, both of you?
Yes.
Dr. Irfan, are you ready? Dr. Irfan, please unmute your mic. I think it's muted. Fatma, please start. I will set the time. I will remind you at 6 minutes and 9 minutes you finish. You are talking with Mr. Jenkins.
Okay. Uh, uh, I want a screen so that I can draw the picture also.
Is it okay? Can you draw it now?
Yes.
Okay.
Okay. Hello. Good morning.
Yeah. Good morning.
I'm Dr. Fatma, one of the pediatric specialist registrar. I hope I am talking to Mr. Jenkins.
Yes, doctor.
How are you?
I'm fine.
Okay. And how is Holi going?
She is suffering because she has multiple time pricks, and this is really painful for me and her. We cannot see her every now and then. She is getting this problem. So they given me suggestion we should have something, some device they are asking to insert. I have no idea what is this and how it will be helpful.
I'm sorry to hear that you are facing problem regarding Holi's condition, and I know that in the last visits during the OPD, you were told about the option of some device which is called portacath insertion, and that's why I
Yeah.
arranged this meeting in my clinic. So, and I have made arrangements, so nobody is going to disturb us. Mr. Jenkins, should I start discussion with you, or you want somebody else with you?
Well, my partner is away. Doctor, you can start, no problem.
Okay. Okay, Mr. Jenkins, can you tell me what is your understanding about the device about which we are going to talk for your child, Holly?
Well, as I was given the briefing by some of doctor, they told there is some tube that will be inserted in the chest and have a connection with some vein, something like that.
Okay. Uh, so let me explain it to you that since Holi is going to have repeated pricks and we have to puncture his blood channels to give him antibiotics and other medicines. That's why that is a painful procedure for your child, and that is a not a good experience for you. To avoid this repeated puncturing of the vein, we have decided that Holi should be provided with some device that can prevent him from this repeated puncturing. Are you getting my point?
Yes, doctor, I can understand what you are telling me. I understand. Yeah.
Okay, I want to explain it with the diagram so that you can understand it more easily.
Yes.
This is basically in the form of a uh, channel, uh, or you can call it a hollow tube that is basically inserted inside the blood channel. And in this way, we have a direct connection with the blood channel. This is the blood channel,
Okay, doctor.
and this is the
But
tube.
yes, doctor. During this procedure, if there's any chance we may trauma the lungs, there can be injury to the lungs, as
Uh,
this area is just near to the lungs, so it's possible we can rupture the lungs or injure the lungs.
That's very relevant question, Mr. Jenkins. Actually, the procedure is quite safe, and it is free of the serious effects, side effects like you are talking about the lung trauma. It is done basically superficially, so chances of lung injury is very minimal because it is performed by the experienced person, and it is performed in totally controlled environment under the X-ray guidance and by the experienced persons who are a specialist specially trained in the X-ray monitoring.
Thank you, doctor. Doctor, how this procedure will be performed? This needs something like sleeping medication, something like that, or without this?
Yes, I can see that you are quite interested and you have quite good knowledge about this procedure and this portacath device. The whole procedure will be told by the specialist who is going to perform this procedure. But I want to tell you that it is made pain free by the local medicine which numb the area, although little
Okay,
pressure is being felt over the area where the procedure is performed, but it is made pain free so that patient should remain comfortable.
okay, doctor. This channel or tube which you will place on the chest,
Yes.
it is any chance of infection to get?
Um, Again, it is a good point. Yes, there are chances that child can get infection, but the environment is usually a controlled environment that child is procedures performed under by the clean hands, and there is a technique which is called a sterile technique, which means no bug or no infection should be transmitted to the child. So these
Yes.
precautionary measures are taken to avoid the infection, but there are signs like skin can get red, child can have fever. If these signs later on can develop, you have to report to the hospital or to your specialist immediately so that infection should be targeted.
6 minutes. Six
Doctor, I
minutes.
got, yeah, doctor, I want to say something else that after this procedure, uh, the child would be having this channel. It
Okay.
is chances of having infection after
uh,
procedure
i'm I'm telling you that the chances of having infection after the procedure once
because
it's
as it would be exposed to the skin would be exposed, right?
is let me explain it to you that this tube is then connected to a hub, and this hub is under the skin, and this hub is not exposed directly. When it is punctured with the help of a special needle, this needle can stay inside for 2 weeks. But once
You
the
mean
procedure has the
you mean this device will remain under the skin. It won't be
yes,
exposed. So
it
it
won't be
means he can
exposed.
take bath, he can do swimming, no problem.
Yes, taking bath, swimming, these are the normal procedure, the normal daily activities, and he can take these activities safely.
Okay. Doctor, how long this procedure will take?
This procedure is very short procedure. It takes only half an hour or 20 to 30 minutes. And after that, child will be able to go home on the same day.
Okay. Doctor, after procedure, what precaution measure you will tell the parents? to get help when he in the in the case he has some problem with this channel. Any precautions?
A very relevant question you have asked. Actually, after the procedure, every 4 week, this catheter, this hollow tube channel should be flushed if medication is being given to the child after 4 weeks. But if medicine is given more frequently, with every medication, the tube will be flushed by the specialized nurse. And initially, we will put some medicine which is for preventing the clots, and beside that you will have to keep the area dry and the clean.
Okay. Doctor, as nowadays we are facing the problem of the COVID-19, so they will do test
Okay.
for it before the procedure?
Yes, for every procedure we perform the COVID-19 procedure. That is not only for the safety of the patient, but that is for the safety of the person who is performing the procedure.
Okay.
Is it okay?
Thank you, doctor.
Are
Yeah,
you
thank
getting
you, doctor.
okay?
Yeah, I got your point.
Okay, let me rephrase it. What we have discussed today. I have told you that Holly needs portacath
Time is
insertion,
up.
which is a device. Okay, which is
Yeah.
a special device to prevent your child from repeated puncture, and this will also save keep your child safe from getting repeated infections. And beside that, I have told you that there are some precautionary measures which you have to take, and that's all for the portacath insertion.
Uh,
Okay,
ये
thank
मैंने
you, Dr. Fatma.
ओके आखिर में मैंने ज्यादा शॉर्ट इसलिए कर दिया क्योंकि टाइम ही खत्म हो गया था.
मैडम
हाँ
ठीक है,
बिल्कुल
Okay.
नहीं
थोड़ी सी
Okay.
डिस्कशन
Yes,
थोड़ी
Dr.
लेंथी थी ना.
Irfan, feedback
Yes,
आपका.
Dr. Fatma has done a very good attempt. She was very composed and calm and good listener, and she tried to explain with the diagram, and she has given all the answer, and she responded very well for all the concern which I raised, and she was having empathy also, and I will say it was good. 90% she did good job.
What about 10%? What 10% she
Yes, this
didn't?
was my
10%
question
sometimes,
also.
yeah, wobbly. She got not in a speaking point of view, she got somewhere wobbly, so that was the only thing. Otherwise, she was
Okay. So किसी और को comment, anyone else has a comment? कोई और comment देना चाहेगा इसमें?
I will just give some negative comment just to shorten the discussion. Like child, we should not say the child, and regarding gender, he and she, we should be very clear about whether she's a girl or boy, because many times Dr. Fatma, you said he and then she, and child also. We should not say this child because of
Okay. Yes, you're
yeah.
right. I confused it with he. You're right.
I have heard one thing that this portacath can be infected itself.
Sorry,
As
come
Dr.
again.
The question about portacath can get infected, can get infection. Yes, it can get infected itself.
Yes, she informed. She told
She
that
told.
there is a chance,
She
but
mentioned
minimal chances, very less chance.
because it is covered by the skin basically, and less chances of infection, and the
Yeah,
portacath is quite safe.
if there is infection of portacath, the only solution is to remove that one. There is no need of antibiotic. Definitely you will give antibiotic, but you will have to remove this portacath.
Dr. Hill, it depends on the stage of the infection and severity of the infection. Initially, most of the time, the infection after insertion of the portacath, it gets healed with the local antibiotics. If the child gets febrile, having chills and high-grade fever, we give antibiotics. But if he doesn't respond, then we have to remove the portacath.
Okay.
If you have read from some guidelines, you can share it, but practically what is done in the
It
hospitals
is
which I am
safe device. and it is very successfully
Yeah,
used.
yes,
It
yes.
is especially in
In
the
extreme
cystic fibrosis.
cases, we remove. In extreme cases, we remove.
Extreme
Otherwise,
cases.
And extreme
Otherwise,
cases mean you got some trauma, something like that. That is a
septicemia.
possibility.
Yeah,
Yeah,
we can say
that time.
may need to remove.
Hmm?
But very rare, not so frequent, because you are giving antibiotics to avoid the sepsis.
Dr. Fatima?
No, Dr. Fatma has replied very well of this when you ask about the lung puncture. She
Yeah, she
told
told
you
it.
all
No,
the
she answered
things
all the concern
very.
very nicely. Yeah,
After that, she said there is minimal chance. But here, in infection, she should also go with this strategy. She will say that she can say we have a good team of doctor and they are looking after for everything. If there is any sign and symptoms, a child will get the infection. We can treat with the antibiotics. But like in any other procedure, it is also there is a minimal chance of getting infection.
yeah.
Dr. Fatima, you
No,
did
she answered. No, she did good job. She given all the concern nicely. She responded in a very
yeah.
calm and quiet way.
I have a few
Yeah, that was
comments, Dr. Fatima.
yes, yes, please,
Yeah,
Dr. Hiren.
you did a good. The only few grammatical errors were there. The content, introduction, and closure, everything was fine. Little bit time were short, running short. The main thing is this is a procedure, portacath. Okay, so you need to also give us some information about this procedure, about like anesthesia. It will be done under the anesthesia. The chances are there it might get fail. Chances are there like infection. You cover a few of the things like infection you mentioned. The role player asked you about the pneumothorax. You fumble a little bit in that answer, but again you came to the track. So another like anesthesia is needed, and some post procedure care. Post procedure care is also you can advise, like there will be a stoma nurse who will advise you whenever there is a problem you can call. Is if there is any redness or inflammation on that area, you need to give a
she
call.
told.
So,
She told these
Dr.
things. She told you to explain these things.
okay.
Redness
She
and
explained.
Actually, Dr.
Yes,
She
Hiren,
explained.
Dr. Hiren,
this
actually,
community
Dr.
nurse.
Hiren, you are right that we should go in order like you are saying, but it is not possible in communication because here the role player asked the direct question of lung trauma, so you cannot leave this answer and you will inform the basics first. So we have to
This is
reply the role player first.
Yeah, I agree with you. Role player consent should be addressed. But whenever
So
there's a
what she
procedure, these are the common steps.
Yeah, these are the protocol for step by communication, as you said, and we are preparing. But in the exam, during exam, everything goes ups and down.
Yes.
So we should prepare all the things. It's with direct bouncer if someone is telling, so that we should be
It's
able
same
to
like
answer
no,
this. Yeah.
you have to follow the role player. You need to respond to the concern. If
Yes.
you go
Yes.
step by step, then you will ignore the role player. That is not acceptable.
Like scenario was like moving on infection. Many times she explained about like repeatedly environment under the control environment, less likely infection. So I thought you will ask probably how should I care, what will happen, what I need to do the care, if will it be successful, is there any chance it can come out from this. So
No, I asked her these questions. She given the answer, I believe.
yeah.
Yeah, she answered this
So
question.
okay.
Dr.
So
Hiren,
we will.
actually, you're right. I was also thinking on the same pattern you are talking about. But actually, role player was behaving like a person who has read about the things and who has knowledge about this already. So he was asking random question from one end to the other end, and that's why I was not able to describe it properly in a sequence which we usually do.
Okay, okay. No problem.
Okay, and the all thing was okay, but Dr. Fatma, we need a little bit confidence in you when you're giving any communication or anything history. You are the doctor, so just a little bit confidence while you are telling something.
She was confident, I think.
Yes.
Somewhere she
I
got
think
fable. Otherwise, she was okay.
Yes, she was confident, but later I think she has a more sympathetic and empathetic than the normal.
That normal today.
okay.
Like you are
No, she
less
was.
sympathetic and empathetic, and she is
No,
more.
no, she was good. No, this tone is required in communication, basically,
Really?
because her style is very good, really. It was quite impressive how she approached and she was talking very nicely in a very comfortable way, and she was composed. And this is
Okay.
required. This is the
Hope
thing.
examiner would
Yeah,
be like you.
I don't know, but I am having a lot of this communications. Maybe for you new, but this is the required. I am also very blunt person.
Okay.
Just the next one.
Next one is Dr. Nihat is there. Dr. Nihat, are you there?
Yes, Dr. Waqar, I'm here.
Okay. Okay. So your environment give you permission for the communication scenario?
Okay, make the history first because I want to arrange myself a little bit. I have some noise here.
So how much time you will take?
Give me 2 minutes.
Okay, no problem. Till that, I will read the scenario and then
Dr. Waqar,
take your time.
Dr. Waqar,
Yes, Dr.
history, I think better we just log off and again log in.
Yeah, it is still communication, I think. How much time it went?
So that whole
Okay. Okay, so okay, I will reconnect it because it will be disconnected at some time. Okay, so join again, please.